So what's the differentiator now? Well, it's actually now, to what degree can you feed the engine a really...
What is that epic problem? Where does that realization come in, and how did that motivate you to start Cogent?
That approach to attracting workers, keeping them happy, keeping them healthy, keeping them working.
What do you think is the biggest driver?
What do they need? What attracts them, what keeps them? And we're seeing it particularly around pharmacy, is if you're on the plan side and you create a set of benefits, you might...
Hello and welcome to Healthcare Journeys. I am your host, Kevin Rosenquist, and thanks for listening. I'm thrilled to take the reins of this great podcast. I love talking to entrepreneurs and leaders in the business world, and I'm excited to bring you their fascinating stories, especially in this healthcare space. It's going to be a lot of fun, and thanks for being here. So my first guest here today is David Meyer. He's the principal of Cogent Advisors, a Nashville-based management consulting practice, and they focus on healthcare and health tech operations, product design, sales and marketing, revenue and quality, and whatnot. So we're going to talk about a lot of different areas of healthcare. So David, thanks for being here. Good to see you.
Really good to connect with you, Kevin. Thanks for having me on today.
Absolutely, yeah. I'm excited to chat with you. So I wanted to start here. I couldn't help but notice that in college, going way back here, all right, you double majored in English literature and biology.
Yeah.
I thought that was an interesting combo. What did you want to be when you grew up?
Yeah. So this is going to scare all the viewers now.
Okay, good.
They're going to get into my psyche. So I believe that non-traditional combos are powerful. So like my kids, I'm encouraging them to do double majors and to do things that don't normally fit together. Nursing and accounting. How many of those are there, right? Mm-hmm. And so I just think if you can take something that is like a core piece of you and then do something that is uncomfortable, do something that stretches you, and it's not for the sake of being stretched. It's because it's unnatural, and because it's unnatural, other people don't tend to do it too, and it makes you unique. So yeah, I was evenly split. So I did bio and chemistry as my minor, and then on the other side, I was an English lit major and a history minor. So I was evenly split majors and minors, and yeah, I just believe in that as an approach to life. So I'm pushing my kids to do it right now.
That's interesting. It's a good idea. I like it. I mean, I will say one major was hard enough, but if you want to really challenge yourself, and that is a way to do it for sure.
Well, there's nothing like your OChem teacher making fun of you because you're a humanities guy, and your humanities people shaking their heads because you're too much of a scientist. So so that's really centering when everyone is kind of frustrated with you. But yeah, I think it's I think we compete now in a global world, mm-hmm. and people say that, but I don't think that they really appreciate what that means. That means that you're not just competing against the kids in your high school or your college. You're competing against people from all over the world that are about to emigrate to the United States.
That's a good point.
And maybe in some cases not emigrate, just compete with you, out of India, or compete with you out of the Middle East. So I think differentiation is going to become harder and harder. Mm-hmm. And I think AI, for instance, it's been splashy about the new SQL AI. So it basically generates the SQL code for you, just using natural conversation as the input.
Yeah.
I mean that was a differentiating thing for a whole lot of folks, right? And it's being taken away. So what's the differentiator now? Well, it's actually now, to what degree can you feed the engine a really succinct and cleverly worded input, so the code you get is better, faster, right? So ironically, right, English major skills are an input to being a coder. and who thought that would ever happen, 10 years ago? But that's where
Well,
we're
you
at.
did. That's why you.
Well, I don't want to pretend I saw that coming, but I mean, but I believe just in general that doing one thing is not enough.
Right.
So,
Yeah. And you ended up in the business side of healthcare. How did that kind of transpire? What drew you to that space?
yeah. So, interesting question. So, I was thinking about doing medicine. It was kind of a family push for me, and the consolation was, okay, I'll do public health graduate work. So I was epi biostat was the area I was focused on, and I'll think about medicine. And I'm an only child. I got a sick mom, and she was being misdiagnosed and mistreated, which is a long story for another chat. But I decided to take a leave of absence. I went out and took charge of her health care. In about a week and a half, she had a completely new diagnosis and was having open heart surgery. So,
Wow.
If non-clinical family members, if you ever wonder, can you make a difference? The answer is yes.
Mm-hmm.
Yes, you can. Using good judgment, right? You can change your family members' lives. So I was in the middle of the quarter, couldn't go back right away anyway, and so I started looking around and found a job in all places of Newport Beach, California, which is so easy to like. I mean, there's like a handful of places on the earth that are as close to perfect as possible, and this is one of them.
That's one of them.
So,
okay.
Yeah, it's just ridiculously pleasant. So, I took the job. I built a clinical data warehouse from scratch in SAS, which is a statistical language, and it is an amazing experience, and it launched my career. And it's about understanding healthcare data because I was loading it and normalizing the data and then merging it together so that we had a data warehouse that we could do value-based contracting and value-based payments. And we were, I believe, nationally the first medical group to be able to run all of our own HEDIS measures. So for healthcare geeks, those are the measures across various clinical domains. And usually the health plans do that for you. But we kind of felt like our numbers were probably wrong. And so we ran them ourselves, and sure enough, they were 8, 10, 15 points off by health plan. And then we spent the next couple of years trying to get the health plan better data. And that just launched my career. I've been value-based care and clinical programs, financial programs ever since.
It's a fascinating story. It's always interesting when, personal stories turn into careers like that. I think that's really, really cool that you went in that direction. And with Cogent, you talk on your website about how that healthcare costs are an epic problem for mid-market companies. What is that epic problem? Where does that realization come in, and how did that motivate you to start Cogent?
Well, I mean, there's a couple of things we do, and I mean, trying to help people understand how to get more value out of healthcare, just writ large, right? Just go up 10,000 feet. It is a huge focus for us. And so, whether you're managing an employee base and really, I mean, what do benefits even mean? I mean, this is now even non-healthcare. We're just sort of just talking about being an employee. What does it mean to be an employee, and what does it mean for the company to provide you benefits? And I think if you go back to the original healthcare benefits, Kaiser was a manufacturing company. They weren't a healthcare company. They were a manufacturing company.
I didn't know that.
And it's Kaiser, and I want to think there was Steel or something like that. And they wanted to keep their employees happy, and so they hired a couple docs, and you could access those docs free, and that's the beginning of Kaiser as a healthcare business. And the manufacturing
for a while. I didn't even know that.
No, the manufacturing's long since gone. But I mean, that approach to attracting workers, keeping them happy, keeping them healthy, keeping them working, right? I mean, it's not like they were doing this out of the goodness of their heart, right? They wanted a healthy, active labor force. They didn't want to lose people to sickness or to moving on to another company, right? Both ways. So they figured that this was a way to solve for that. And here we are now amidst every major news outlet, all they're talking about is RIFs, right? And the government RIFs right now have a lot of people's attention, and happily for a lot of big corporations, it's allowing them to do their RIFs very quietly. but there's a lot of RIFs going on in just traditional corporate in America. And so, is that right sizing after COVID? What is it exactly? I mean, it seems a little early for AI to be having a profound impact on the workplace. So I don't think
I think it has a small impact. I mean, honestly, I think that there's certain things that maybe certain positions, or maybe the amount of positions you need in certain areas are less, but I don't think it's making as large of an impact as certainly as COVID did.
Yeah, but not yet. I mean, it will have more of an impact. But I'm with you. You're right. That there is some early impacts, and in some industries specifically,
right, and departments specifically too.
Like
certain departments, certain areas of a company are going to feel it more than others.
Yeah. I mean, in healthcare, I think the obvious early application will be radiology. I mean, I think there was a graph I was looking at the other day, and it was kind of looked like the one really long bar, and that was the number of AI companies in radiology, and then the next one was zoop. it's like over here, and then everything else was just right down the side. Right?
Yep.
There's radiology, and then everything else.
I could see that.
We'll see impacts there, and it doesn't mean don't go into radiology, but it means that you'll practice it differently, right? But anyway, so getting back to companies and benefits, so I think what does it mean for companies to keep their workers healthy and happy? A lot's being talked about a resilient workforce. A lot of CEOs talk about resilience, and I joke about online, sort of air quotes joke that sometimes when CEOs talk about resilience, what they're really saying is, stop complaining, dig deep, shut up and row. I like,
rub some dirt on it. Rub some dirt on it. Yeah.
But I mean, that said, they're sincerely worried about productivity. They're sincerely worried about the competitive market, right. And whatever the attempt is to motivate, I think that's real. And so benefits are a big piece of this, right? How do you attract people? How do you keep people? And we have in the United States right now a couple weird things that I'm not sure exactly how it's going to shake out over time. So the first thing is high deductible insurance, which on its face seems great, right? You can't afford a big payment per month, right? Well, maybe you have a job that doesn't make a lot of money. Maybe you make $50,000 a year, and $600, $700, $800 a month is prohibitive from a spend perspective for healthcare, right? You need to get that to $350 or whatever, right? So how do you do that? Well, you do maybe a high deductible policy, right? It's one of the choices. There's others, but and the idea being that you're going to self-maintain for all the small stuff, and that insurance will be there if you get an automobile accident, if you get cancer, right? And it's going to save you from destruction, but otherwise you're just going to have to really kind of keep on top of things. And one of the odd things about how just people engage with that insurance, and we're seeing it particularly around pharmacy, is if you're on the plan side and you create a set of benefits, you might take a generic medicine and say we're gonna charge $8 a month for this medicine, very cheap, right? Well, that medicine may be $3 retail. So 8 is like a massive percentage increase,
right,
in terms of what the actual cost is for that med. And there's a lot of splashy folks. One of them owns a sports team and is getting into pharmacy, and he makes the point, like, this is crazy. Like, Why are people spending so much money through insurance for something that they could get cheaper another way? And he talks about all the other ways that you can get those drugs. So what's happening though is the insurance company is saying, okay, we're going to bring this sky high drug down in cost, and we're going to fund that by taking these really cheap, them up a little bit, but hopefully people won't notice. And that is how that's how we're going to fund pulling this set of drugs, or a couple really expensive ones that some people really need, how we're going to pull that cost down. And so it's meant to work as a system, right? Maybe for me, I'll pay a little bit more,
Right.
but you might need a really expensive drug that comes down in cost for the health plan, so they can put it on panel for you. And that's amazing for you, because now you have access to a life-saving drug. But on an individual basis, it doesn't work, right? So if I look at just my spend, I have 2 generic drugs, and I'm paying 2.5 times what I should be paying retail for those drugs. Right. So what do? Well, I stop using insurance. I don't even present insurance anymore. I go to CVS and I just say, hey, I'd like to fill this prescription. They say, do you have insurance? I say, no, just retail price, please. And so now a couple things have happened, right? I'm not part of the data stream. So now the health plan doesn't even know that I'm taking the drugs. They don't know if I'm compliant or non-compliant. They don't have a line of sight anymore. The second thing is that slight additional bump in spend that they were capturing from me buying those generic drugs and offsetting the other, well, that's going away now. And so the basis for affording that very, very expensive therapy now is somewhat being undercut. But the most important thing is that let's assume again, I've got a high deductible plan. The most important thing is I'm not paying against that deductible anymore. So let's say it's a $2,000 or a $4,000 or $10,000. I mean, some of them are really big, right?
Yeah.
$10,000 deductible. So I'm not paying against that. And okay, it wasn't a lot per month. Okay.
Yeah, it was a small amount.
$10, sure. $10-12 a month. So is it a lot? No.
No.
But this stuff adds up.
Right.
And okay, the copay for a hospital would be $200 or $300 or $500 or something like that. That would go towards the deductible. But in this case, I'm going to do urgent care, or even better, I've got somebody at my synagogue or my church that's a doc, and help me, and they're going to write a script for me, and I'm not going to pay anything, right? Mm-hmm. And so what you end up having is, these just massive deductibles, and what they become is a barrier to you getting any care at all, because you're going to be paying 100%. We're not even close to the $8,000 or $10,000 deductible. So it's all going to be out of pocket. So do I do the academic medical center? Shit, no. Like the local hospital, community hospital. What else is? What are my other options? Walk-in clinic, maybe. But synagogue, that one's free.
Don't discount the synagogue option. Yeah.
No, I just say no. I get it. I totally get it, and I don't blame the public for doing this, but I just recognize that what you're doing though is you're disengaging from traditional healthcare and all the structures that are designed to kind of support you through healthcare. And admittedly, a lot of the American public are complaining about them very loudly right now. Absolutely. Utilization management's getting kicked really hard. Prior auth, stuff like that. But you're not even part of it, because you're doing a friend and you're doing out of pocket for your drugs. And then you are going to engage, but for an automobile accident, and they don't even have line of sight that you have diabetes now, because your buddy at church diagnosed you and they got you on metformin. The health plan doesn't even know. So I mean that's not insignificant. I mean, it changes how you heal, and it changes how you would treat the patient. I mean, so we're in a weird spot right? I mean, that original choice that Kaiser made, let's get everybody taken care of. Let's keep everybody healthier than they would have been otherwise, right? And we'll have a single point where we can check on our employees. How are they doing? How's everybody doing? Is there anything we could do across the employees? And this is literally the beginning of kind of like disease management, is Kaiser having conversations with those physicians about, how can we better support our employee base? I mean, it's just an organic, beautiful thing, but we're going the other direction, right? We're stepping it back. So, do companies have the gravitas to take some of that on? If they self-insure, if they pull back from using traditional insurance structures and they say, no, we're gonna do this ourselves, and we're gonna get catastrophic insurance for ourselves, so we don't get bloodied up if somebody has a big bill.
Yeah, if someone
that's been in the news, by the way, lately. I'm not going to mention any companies, but that's been in the news lately and not helped a company's stock price because they're in that business. So I think it's just like a weird spot, right?
Mm-hmm.
And that concept of catastrophic insurance on top of a company kind of self-managing. What does that even mean? I think that there was spillover when these structures were first put in place. There was spillover because a lot of people had maybe insurance through their spouse, and it's just there was sort of like a quilt. But more and more people now are single-threaded on insurance. One of the spouses is laid off or rift or whatever, and so this is now a thing. And what made U.S. health insurance work, where some people paid too much, same is true at the ER, right? Some Americans pay too much so that people with no insurance can still be seen in that ER, right? Government mandates the hospital has to see them. So how do you pay for them? Well, some people have to pay too much. It's just how our system works.
Yeah, it is.
And we're at a spot now where we kind of can't keep doing that. And so we've been a very generous society, and we had enough money to float it. And as things tighten up, where do they tighten up? And I think it's going to be fascinating over the next 5 to 10 years to see how companies tackle this. What does it mean to support their employee base? What do their employees really want?
Mm-hmm.
Really want? Is high deductible insurance a good thing? Do you, for instance, narrow the networks dramatically down to just you can use a local hospital and you can use a local medical group? Everything else, we're going to get you catastrophic insurance, and that's going to be out of pocket. We're going to get insurance to knock it down, but you're on your own there. And we're going to go like back early days with Kaiser, couple docs, one hospital.
Yeah. Do you think that the self-insured concept? I think that a lot of people might say, oh, that's for big companies. That's only for huge companies. Do you think you guys kind of help smaller companies? I think, was it 50 employees roughly is probably around? Is that, would you say, around the thresholds for the self-insured?
Yeah, traditionally, I just think there's so much interest in, a dear buddy of mine just started a company in this space. I mean, there's so much interest in helping companies come up with new ways to support their employees.
Yeah.
And I think they're very clever ways to kind of share risk. As like from a traditional insurance perspective, right? We're gonna chop it up and spread it out, thin it out. But there's also enough cost savings with companies managing the individual care, even with small numbers of employees. It's just how is the actuarial piece done, right? And how do you assess your risk based on your employees, and what kind of catastrophic insurance do you get? But in the end, I think this will be a go-to. There's no doubt in my mind this will be a go-to. And like ACA, you can already see it. It's been coming for a while. Famously, for those of you that follow politics, Trump in his first term almost killed Obamacare. He was one vote away. And if you don't remember the story, it was a gentleman who had very late stage cancer who campaigned on getting rid of Obamacare, but he was so mad at Trump. John McCain went from Arizona all the way back out to Washington to cast his no vote for that legislation, and ACA was saved. But I think the Trump administration is in a different spot. I think ACA is absolutely in the crosshairs right now. What they'll do, when they'll do it, I don't know. So what does that do for companies? If they were using the exchange, for instance, as a way of providing healthcare for their employees, what does that do? And I think there's so many question marks coming up here near term over the next 5 to 10 years. Everybody's just going to have to really be on top of this, looking for alternatives, looking for a plan B and a plan C just in case, and having it ready. And there's no harm in having that plan B and C just waiting in case you need it. And maybe everybody's happy with A, but you get it on the books. So I think a lot of companies will be doing that. And yeah, you're right. Somewhere around 50 employees becomes the witching hour, and then people greater than that, I think, start to have some scale, and they're able to do more.
What's driving the change, the push towards this? Do you think is it costs, or is it employee desires, expectations, demands, whatever you want to call it? Is the perspective of healthcare changing for the younger generations, where they're like, this isn't working anymore? Like, what do you think is the biggest driver?
Yeah. I mean, definitely cost, and your instinct that satisfaction is down is 100% correct.
Yeah.
So you've got like the worst of everything. If you're in HR and you're in charge of your company's benefits, and you're writing these massive checks.
Yep.
And all you hear is complaints, and it's like, all right, what's plan B? Because
what more can we do here? Yeah.
Yeah. But I mean, the cost is out of I don't want to be unfair. I think a lot of insurance companies are some are trying, some are maybe taking advantage. We don't have to mention names, but I think that there is an attempt to keep that line of business alive at a lot of insurance companies. It's getting tough.
Yeah.
It's getting tough. And I think the lack of satisfaction in it, in those products, is making it tougher. But what's the alternative? And I think that's a challenge in the U.S. right now. I mean, with really popular diabetic drugs now being used for weight loss, cost $1 bazillion, and is that satisfaction? Everybody gets that. Is satisfaction? Everybody gets let's call them sexual performance related drugs. Again, not inexpensive. And so, what does satisfaction mean? Does it mean saving your life, or does it mean having a better life? And I think if you look at some of the anti-diabetic, anti-weight loss drugs, that's kind of having a better life and having a longer life, right? Not necessarily changing your healthcare today, but trying to change the trajectory of your healthcare, right?
Mm-hmm.
And that's great. Improving your relationships for relationship orientated drugs. I mean, I get it. I get it. And none of us want to be unhappy, right? But I mean, in the end, what's the obligation of companies? What do you cover? What do you not cover? And I just, we're so far past the days, where, like back in the day, Twitter had multiple cafeterias, and my memory is somebody told, they had like microbrews and stuff like that.
Yeah. They had bars and stuff, and Yeah.
Really?
Mm-hmm.
So I mean, I remember I was at a .com once, and we had a pool table, and they emptied the big 5-gallon water jug and put margaritas in it like once a month. So I do remember like those kinds of choices.
I'm surprised you do remember. That was a big jug of margaritas.
I do. But I mean, I mean, it's not obviously it's not going to happen for so many reasons. Liability being the first. None of those things are going to happen anymore. But
Totally.
I mean, we just don't have the money in the system. I mean, like that, we just have to be so much leaner. And so, what's that new normal look like? And I just it's going to be fascinating to see how companies pivot, how they support their employees, what satisfaction, what role does satisfaction play?
Right.
I mean, and how do you measure it? Is it you can be grumpy, but if you didn't leave, I'm going to assume you're satisfied enough. And there are people that advocate that definition.
That's a good point. I mean, it's one way to put it. Yeah. I mean, sometimes it becomes options. I've definitely been at jobs I didn't really like because my options might have been limited at the time.
Right. Yeah. Yeah. And there's this wonderful idea in psychology that option 2 is always in the light of option 1, and to the degree option 2 is better or perceived to be better, even if you would have never accepted 2 if it was the first option, by being given option 1 first, option 2 looks great. Right?
I do that with my son. He's 4. I do that with him. Whatever I want him to pick, I'm going to say second.
No, but it works. I mean, you do it because it works, right? I mean, you didn't do the psychology research. You just know in your heart.
I just know how he operates. Yeah,
totally. But this is true. And I, my spouse just took a new job, and we're looking at the insurance options, and option 1 was shockingly expensive. And it looked really similar to option 2, right? Which was less expensive, some small changes, or they're actually big changes, but they look like small changes.
Yep,
but
the way they're put in front of you, yeah.
That was done on purpose, right?
Yep.
And to make that plan B look dramatically better than plan A. So, I take for granted that we'll do that, to our 4-year-olds. My youngest is 9. I do it to her. It still works. So you got a couple years, glide path. Yeah, absolutely. But I take for granted we'll do that for employees. Give them choice, but
right.
Is it really 4 options or is it really 2?
Right.
And one is ridiculously terrible, the other one is ridiculously expensive, and then there's the 2 that like
find the just right porridge in the middle somewhere. Yeah.
Yeah. So it's the Goldilocks principle, right? So I think companies are going to still want to give their employees choice. Particularly big companies are going to want to give their employees choice.
Yeah.
There still is competition. Granted, like we're starting out talking about impacted departments when it comes to AI. That there is a narrowing scope of the employees that are critical to operations, right? So there's employees that execute operations, but then there are employees that just are deal breakers to not have. And so you just can't lose those. You want to keep as many as you can, right, across the board. But then there's the can't loses. And every company has their way of identifying them and tracking them. But what do they need? What attracts them? What keeps them?
What keeps them,
and then what keeps your overall employee workforce happy? You care about both, but your CEO demands that the subset, and so I mean that's what attracts those kids. And you asked the question before, and like what about the kids directly out of school? What are they differentially looking for? And I think your instinct is right. I think that they are fundamentally different. My favorite new stat is the generation just coming out of college right now thinks that success monetarily is somewhere between 500 and 600,000 a year. That's the definition of success. And all the generations prior to that, it's like 180 to 220.
Yeah.
So they're like 3x more in terms of compensation. And this is the generation that's grown up around influencers, right? People their own age.
That's a good point. The YouTubers
that are making a lot of money.
Monetizing their content.
And so the perspective is totally different.
Sure.
So, in an environment where option A is 500, $500,000 a year, and then, okay, but I'm not going to offer you 62,000 a year. I mean, that's
big.
tough.
It's a big difference.
That's tough.
Yeah.
And so what does satisfaction mean for kids just coming out of college? I don't know. It's going to be tough. A lot of companies are purposefully avoiding recent grads. And this is part of the problem.
That's part of the reason why, because of the expectations.
How do you keep them happy?
Yeah.
How do you keep them happy? Yeah.
Wow. Well, it's certainly going to be an interesting dynamic to watch over the coming years. David Meyer with Cogent Advisors. Thanks so much for being here. I really appreciate your time.
Absolutely.